From the South Carolina Honors College, this is Polluting Patients. If the U.S. healthcare sector were a country, it would rank 13th in the world for greenhouse gas emissions. The goal of Polluting Patients is to teach people about the environmental and corresponding health impacts of the U.S. healthcare system and what we, as healthcare consumers, clinicians, and leaders, can do about it.
Welcome back to Polluting Patients. I'm your host, Miley Phillips. Today, I'm going to be discussing how an integral part of our healthcare system in the United States, electronic medical records, and an up-and-coming advancement in clinical care, artificial intelligence, are not as great as they seem. For the environment, of course. Now, I don't know about y'all, but from a young age, I've always been told a way that I can help the environment is by saving the trees and using less paper. But in reality, does that actually work? This was the principle behind a 2009 government mandate that has led to the widespread use of electronic health records as well as electronic medical records. The goal with EHRs and EMRs, respectively, was to make record keeping in clinical settings more efficient and more eco-friendly. So they were all kind of marketed with the same idea. Less paper equals less trees cut down equals a happy environment. And while electronic medical records and health records have improved efficiency in clinical settings and streamlined patient care, they have definitely fallen short on the whole eco-friendly side of things. In fact, electronic record-keeping systems have been found to emit substantially more greenhouse gases than paper medical record systems. This is because electricity is needed to power electronic record-keeping systems, and they are drawing power constantly, all day, every day, in clinical settings. So the reason they're less sustainable and have a greater impact on emissions than paper systems is the associated emissions with where the record-keeping systems are drawing their electricity from. But if we're going to talk about how technological advancements within the healthcare sector are contributing to greater negative impacts on the environment, we also need to discuss artificial intelligence use in healthcare settings. Artificial intelligence is now a common tool for medical providers to use to help them with their daily duties. It's the new normal for your medical providers to ask for your consent for your visits to be scribed by AI and for clinicians to use artificial intelligence to streamline their charting. Now, if you don't believe me, because this hasn't happened to you yet, maybe you'll believe a study done by the American Medical Association, which found a 78% increase in the use of artificial intelligence among physicians from 2023 to 2024. But AI isn't just being used by medical providers. Hospitals themselves are using it too. In 2024, 71% of hospitals in the American Hospital Association reported using predictive AI for various administrative and billing tasks. And while AI may help clinicians during patient encounters and help ease the administrative burden for hospitals and clinics, there is a hidden environmental cost that isn't being focused on during this artificial intelligence boom. So what is this hidden environmental cost that I've been referencing? Well, artificial intelligence systems, specifically the deep learning models that are used in healthcare, require substantial resources and energy consumption to run. A 2019 study estimates that training a single large artificial intelligence model emits as much CO2 as 5 cars over their entire lifetime. And all of these emissions are coming from AI data centers. And that is where the real problem for both electronic health and medical records and AI lies. Data centers are the backbone of AI and electronic health records. They are the reason they are able to run, and like the name suggests, stores all the system's data. And to do so requires huge amounts of energy and water to ensure the continual operations of the tools and technologies behind AI and electronic medical records. As of 2020, 1% of global electricity consumption was attributed to artificial intelligence and digital services. And while that 1% does not seem so scary right now, it is expected to grow rapidly with the increase in demand for AI, specifically with an 160% increase in power demand by 2030, 4 years from now, all driven by AI. And the problem with this is that the data centers that are powering AI are not powered by renewable energy sources, and instead are utilizing natural gas and coal to power their 24/7 operations. And when it comes to AI data centers, electricity isn't the only problem. They also deplete natural resources such as water and rare earth metals. Large AI data facilities use up to 5 million gallons of water daily and 1.8 billion gallons of water annually. This is the equivalent of water use for a town of 10,000 to 50,000 people. This insane amount of water usage is beginning to raise concerns about water scarcity and the infrastructure of cities and towns that have to process additional wastewater, leading to health concerns. Data centers also deplete rare earth elements as they are required for the technology hardware. The mining of these elements is leading to habitat destruction, biodiversity loss, as well as water pollution. This is causing continued and worsened environmental degradation and increasing burdens on human health. And the concerns with data centers with data centers for artificial intelligence and electronic health records doesn't stop there. There's also an issue with the creation of electronic waste, better known as e-waste. So, e-waste is discarded electrical or electronic devices that often contain toxic materials like lead and mercury. And the disposal of e-waste has been linked to numerous impacts on the environment as well as on human health. Examples include soil and water contaminations that impacts communities that live near the disposal sites for e-waste. And a major problem with e-waste is this idea of planned obsolescence in technological development. New technologies are created and generated at an increasingly faster rate. And with that, the amount of e-waste is also increasing at a rapid rate. This is due to the short life cycles of technologies that are used in data centers, as well as the development of new technologies each and every day that make previous components used in data centers obsolete. So, when we look at the big picture, artificial intelligence and electronic medical records can be extremely beneficial to the delivery of healthcare and the efficiency of it, but they also have a major downside when we look at their effects on the environment and consequently our health. But what can we do about it? Well, I will be discussing opportunities for sustainability and improvements for our health as well as our planets and in a later episode. So, why don't you stay tuned? Next episode, we will be discussing how waste from hospitals and clinics are impacting our environment. And with that, thanks for listening to Polluting Patients. Remember, a healthier planet is a prescription for healthier people. Keep pushing for sustainability in healthcare. See you next time.